Hello, this is Dr. Kelly Mulhern from Thrive Wellness Center, and today we're going to be talking about hormonal headaches. Hormonal headaches are amongst the most difficult to pin down, diagnose, and treat, and I believe they're probably quite misdiagnosed or undiagnosed because of that, so therefore they are not properly treated, which leaves hundreds of thousands, if not millions, of people suffering every year with hormonal headaches. Again, I'm with Thrive Wellness Center, so there's a list of some of the services that we provide in our office. And I did want to start by thanking you for taking the time out of your crazy schedule. I know that you probably have lots of other things that you could be doing during this block of time, so I congratulate you for putting your health as a priority and wanting to learn a little bit more about hormonal headaches. I do ask if you have questions that you go ahead and send me an email with that. I will have my email address at the end of the presentation for you. These webinar presentations do vary in length, anywhere between 15 and 30 minutes. I try and make them no longer than 30 minutes, so that gives you kind of an idea of the time block. A little bit more about my background. You can see lots of degrees after my name. In addition, I like to mention that I've been a member and a volunteer for the Foundation for Wellness Professionals for quite some time. That is a 501c3 nonprofit organization that is dedicated and committed to educating people in our communities about health and wellness options. So I go into the community and I do talks like this at no cost to businesses and organizations to again help increase awareness of health and wellness options and different things people can do to boost their own health naturally. By training, I'm a doctor of chiropractic. I also have a master's degree in public health with a concentration in epidemiology. Sometimes I get the kind of question mark look with that. That basically means that I spent almost 2 years of postgraduate work learning about infectious diseases, viruses, bacteria, epidemics, pandemics, and the whole 9 yards. So pretty interesting. I'm currently enrolled in a postdoctoral certification in functional medicine or functional wellness, and I have obtained a postdoctoral certification in the diagnosis and treatment of accident-related trauma injuries to the head and neck. The other thing I like to mention at this point is that I am on a mission, and my mission is to help as many people as possible live happier, healthier, and longer lives with no drugs and no surgery, if that is possible. So again, that is my mission, and I can only see so many people in my private practice in the Tampa Bay area, so therefore I do talks like this to reach a wider variety of people so that they can again understand what their options are. Now, there are many different types of headaches, and if you have seen any of my other webinars, then you'll know that we've already talked about several of these. But in a nutshell, stress headaches are one type, allergy and sinus headaches are another type, cluster headaches, high blood pressure headaches, hormonal headaches that we're going to be focusing on today, and migraine headaches. Now, there is one more type of headache that I mention in every single webinar that I do on headaches in every single class, and that is a pathological headache. A pathological headache is one that is caused by something bad, like an aneurysm or cancer, something along those lines. So oftentimes with a pathological headache, the person may be experiencing the worst pain that they have ever had in their head. If they have a history of headaches, this would be a headache that is unlike any they've ever had before. So pathological headache always has to be ruled out when we're talking about some of these more serious types of headaches. Now, with all these different types of headaches, the appropriate treatment, of course, is determined by figuring out what the cause of the headache is. If the person's having a hormonal headache and we treat it as if it's a stress headache, they are not going to get the results that they're looking for. And just to add insult to injury, you can have more than one type of headache at the same time. So you could have a migraine headache on top of a stress headache, or a sinus headache combined with a hormonal headache. So fun times. Therefore, proper diagnosis is critical to ensure that we're providing appropriate treatment. All right, let's dive into hormonal headaches. Now, the location of pain in terms of where is the pain on the head when we're talking about headaches, can really give us some insight as to which type of headache it is. Hormonal headaches oftentimes will have pain around the temple. Now that is very similar to a stress headache. They may have pain behind the eyes, which can mimic a sinus headache or a post-traumatic headache. And they can also have forehead pain, which again can kind of resonate for a sinus headache or a traumatically induced headache. And again, I should mention that everybody can experience these headaches differently. I have had patients where their hormonal headaches manifested with whole head pain. Sometimes it's the top of the head. So the location doesn't give us 100% of the story. We still have to look at the history and some other factors as well. Now, as the name indicates, the cause of a hormone headache is a hormonal imbalance. Now, I apologize, it's a little fuzzy, but you can see below a very simplified version of a hormonal cascade. Very simplified. Chemically and biochemically, there are dozens and dozens of steps that happen in your body when your body is making a hormone, using a hormone, taking one hormone and converting it to something else. So very, very simplified. Most of the time, people experiencing hormonal headaches are women, and oftentimes it is right around the time of their cycle as their estrogen and progesterone becomes out of balance. So that is the number one cause of a hormonal headache, hormonal imbalance. Now, the signs and symptoms of a hormonal headache can oftentimes be bilateral, which means on both sides at the same time. Why? Because hormones are systemic. It's not like the hormones are only happening on one side of your body. Other signs and symptoms in addition to the head pain, oh, my aching head, look at that poor girl. They may trigger nausea and vomiting. Certainly fatigue, pretty much any headache can cause that. Emotional distress, and that is the result of the hormonal roller coaster that the person is going through. I love this little cartoon. Warning, due to influence of hormones, I could burst into tears or kill you in the next 5 minutes. One of the two. Now, treatments, we have to address the underlying cause, as is true with any headache. First and foremost, we have to balance the hormones. Otherwise, those headaches will go on and on. Now, a couple other kind of hallmarks or little red flags for me when I'm talking to a patient with a history of headaches that may help me to lean more into the hormonal headache realm. Oftentimes, nothing touches these headaches. So they can get massage, they can go to sleep, they can drink a gallon of water, they can take a handful of over-the-counter non-steroidal anti-inflammatory medications or prescription medication, and nothing makes it go away. It might dull it down a little bit. It might give them a reprieve for a couple of hours, but these headaches are characterized by they linger and they last. They can go on for days. They are miserable. So we have to balance those hormones. At the same time, we can do palliative care, and that's going to be different for every person in terms of what helps them get through this headache the best with the least amount of pain. So we can try cool compresses, warm showers. Sometimes we alternate. Sometimes caffeine will help to increase that circulation in the brain. Sometimes sleep will help. Hydration, really important with any of the headache types. Deep tissue laser therapy, we'll talk more about in a minute. Massage can help. Acupuncture, chiropractic. So again, it just depends on the person in terms of what is going to make them feel the best while we are waiting for those hormones to balance. Deep tissue laser therapy, I mentioned just a little minute ago. This is a clinical intervention. It is a therapeutic laser, not a cutting laser. It's non-invasive, so all the person feels is a nice, deep, relaxing warmth with the laser. And then that laser energy is going to increase the body's own ability to heal and repair its own tissues. Some side effects to that can include things like decreased inflammation, decreased pain, increased range of motion. Treatments are painless. They are fast, anywhere between 5 and 10 minutes typically. Again, with a hormonal headache, this would be temporary and palliative, but for somebody who's really in the grips of it, it can make a big difference in helping them get through their day. So how do we balance hormones? Well, a couple of things that we can start with. Very simply, having people keep a symptom journal. This can go hand in hand with the headache log, but it is going to track what symptoms they're experiencing and when, so we can start to see patterns. We can do this to help confirm that it is a hormonally induced headache. We can do this so that as symptoms start to progress, the person can recognize it sooner and hopefully get in front of it. But at the end of the day, we have to test. We can guess all we want that the hormones are out of balance, and we can try the interventions that we want to try. But at the end of the day, for an evidence-based approach, we have to know where we're starting from, and we have to know how do we measure progress. Okay, it's great to say the headaches are gone, but the headaches will go away in a few days anyway as the hormones naturally kind of balance out. What we're looking for is a way that we can intervene to keep the hormones level throughout the month so that the person isn't riding that roller coaster of ups and downs, which is very hard on them emotionally, it's hard on them physically, and it's hard on the body as well. Now, there's tons of different ways to test hormones. Commonly when people go to their primary, or if they come in and they tell me they've already been tested, most commonly they've had blood testing. And that's really the literature over the last 5 to 10 years. That is not the best way to measure hormones. You can use hair, you can use saliva, but again, the literature over the past 5 to 10 years is very clear that urine is the best way, which is kind of good because that means it's very non-invasive. We don't have to stick you with a needle. You don't have to go to a facility. You can do it in the comfort of your own home. We actually have testing kits we can send to you, or you can pick up at the office. Do it in the comfort of your own home, mail it in, we get the results very easy. And that gives us our baseline, and then we can start treatment and reassess later to make sure that we have hit the levels that we need to hit. So again, urine testing is the testing that I recommend. And then once we have that testing done, so we know exactly which hormones are too high, which ones are bottomed out, what times a day are they out of whack, then we can look at proper supplementation or medication to help people balance those hormones. And then periodically we retest and make sure we're still in the ballpark. Back to the palliative measures, essential oils can be wonderful for somebody in the midst of a hormonal headache. A few of my favorites, clary sage is actually a phytoestrogen, which means it is a plant form of estrogen. So if somebody is having estrogen balance issues, clary sage can sometimes help with that. Its counterpart is thyme, and thyme is also a phyto hormonal type of oil, only this helps balance progesterone. So typically those are the two at war, and by using one over the other at the right time, we can help to balance things out. And then lavender is always great to relieve stress, relieve anxiety. It can help reduce pain on a neurological level, which means that you can apply it topically and it can help your brain not feel the pain as much, or help your brain not perceive the pain as much. I kind of think of it like the pain is still there, but you kind of don't care as much. So those are my top 3 oils when we're talking about using oils to intervene with a hormonal headache. You could also use pretty much any of the mints, anything that would open the blood flow and circulation may help. Again, temporary palliative. In my office, I support Doterra Oils. So if you go to our website, you can click through and this takes you to our online portal. Doterra products are what I call nutrition grade, which isn't an official designation, but they are mostly organic, certified pure, therapeutic grade. Most of their oils can be taken internally if that is the appropriate way to take them. So I like having that flexibility. So Doterra, there are other companies out there that have great oils too, but I just caution you, if you're going to be putting an oil in your body or on your skin to address a health issue, you want to make sure it's pure and that you're not using something loaded with chemicals or toxins. So to that end, I would steer people away from buying through the big box stores or buying online, because you never know what you're getting in terms of a third-party retailer. Going direct to a source that you trust is important. Now, supplementation, the supplements that would be recommended would depend 100% on the results of the test. Sometimes I get people in the office who are trying to save a little bit of money, and while I respect that and totally understand that, we're not going to get the results we need if we're just throwing a dart on the dartboard. We need to test it. We need to figure out exactly how we're going to help you best instead of doing trial and error. So supplementation 100% depends on the results of that hormone assessment, and taking the wrong supplement or taking them without the proper testing can result in an increase in your symptoms, an increase in issues. It can result in different issues. So again, it is not at all what I recommend. So testing is imperative. Now, in terms of supplementation, I don't retail supplements in my practice. Again, I use an online portal. It's free for me to recommend supplements to people. It is free for them to create an account and go in and look at those recommendations. And then they can order the specific supplements of the specific brand that I like and have it shipped to their house, and they don't have to run all over town trying to find which health food store carries which supplement. So you can see here my note again, do not use a big box store or a third-party retailer with anything you put in or on your body. Way too many cases of counterfeit products being provided when people purchase from a third-party retailer. And the big box stores are typically carrying a lower grade, whether it's supplements or oils. So for supplements, I only recommend physician-grade supplements. I do have certain brands that I like. And then the portal that I use, they get their money. They get paid by the nutraceutical companies who pay them to be partnered with them and essentially visible to the providers to be able to recommend. So that is FullScript. That's the portal that we use. Now, a few obligatory disclaimers. Nothing in this talk was intended to replace medical advice. If you are suffering from hormonal headaches, please, please, please reach out to somebody who is a qualified healthcare provider that can help you properly diagnose and properly treat these. So again, you are definitely encouraged to work with a qualified healthcare professional, especially one who's well-versed in holistic health, nutrition, supplementation, and other alternatives to help you get the best results possible. And just know that not every supplement or oil or other option may not be appropriate for an individual person, and it's certainly not recommended that a person do everything that was in this webinar without working with a healthcare professional. Okay, so I think that about wraps up today's presentation. Please stop suffering. As promised, there is my email address as well as our office number and our office website, where we are continually putting new material up there to educate people on health and wellness. So I hope that you found the information from this webinar useful, and I hope you decide to take advantage of our special offer. This is Dr. Kelly Mulhern from Thrive Wellness Center, where we believe your body is designed to thrive.